My personal feelings of Joe Rogan aside, I think he's the modern day Howard Stern, just to really cut it short. I don't really have a lot of respect for his kind of wavering stance on censorship. Hey, he cashed out and he's not going to let some of his old podcasts go back up. Okay, whatever, fine, fuck it. It's good money if you can get it, but don't be trying to lecture anybody on how to live their life. Outside of that, yeah, he seems like a pretty decent dude, okay? He has one of the biggest platforms out there giving him a ton of money in order to host the most popular podcast of all time, really. I don't think that there's anything comparable at this point when it comes to watchability. I haven't seen anything since it's gone over to Spotify, and like several million of other people, they've just kind of dropped off, and his popularity is at the lowest point that it's been since his rise to prominence. But hey, I don't wish him any ill will. I wish him ultimate success, just showing that there is legitimacy in a guy with a microphone just having a conversation with people. I like it a lot, and I think that it's probably the future of entertainment and media as a whole. And unlike his competition, because he's competing not with any other podcasts, nobody can touch him, okay? He's competing with the likes of the CNN, NPR, all of the fucking mainstream media that's out there. And since it was revealed late yesterday or earlier this morning, I'm not entirely sure of the time frame on this one, but it reveals, that he had finally caught the Coof. After all this time, he got a positive test come back, and his doctor advised that he went on an entire litany of prescribed medications in order to bounce back as best as he possibly can. Now, again, that's very important to point out here. His doctor helped him make those decisions, okay? If you're going to be listening for medical advice for guys on fucking YouTube or Spotify, I don't know what to tell you. I have faith in my audience that you guys aren't going to be doing that, but there are apparently some dumb people out there. The media like to use them as straw men who would just listen to a jackass alone in his fucking room talking into a microphone, or just sitting across this table from somebody fucking in between jokes saying that couple of things might help them feel better in between dick jokes is somehow ironclad medical advice. Like, go fuck yourself. But I wish Rogan nothing but a speedy recovery, obviously. Continued success and upward trajectory with everything that he does. But because he took the dreaded I word, yes, Ivermectin, and a whole host of other things, he's enemy number one right now. And we're just going to go over this whole Ivermectin thing because I find it interesting, right? Now, again, I'm not telling anybody to fucking take Ivermectin. I'm not a doctor. I don't pretend to be a doctor. Because it's YouTube, I have to give you that disclaimer because they think you're so fucking stupid you can't make informed decisions by, going to your own fucking doctor to figure this stuff out. But again, because they're trying to pillory him on this one, just like when he said that younger people probably have a decent shot at getting past a positive diagnosis of the Coof, therefore them being eager to get the poke, it's a little bit more understandable that people aren't lining around the fucking block that also have pigtails in their hair and little patent leather shoes. It kind of makes a lot more sense if you just do a little bit of research yourself. But enough preamble, let's get into this. Joe Rogan, a high-profile podcast host. I don't think high-profile is a good enough description, but okay. A comedian and UFC commentator revealed that he was diagnosed with COVID-19 and took a cocktail of interventions to treat his symptoms, among which was Ivermectin. Oh my god. In an Instagram post on Wednesday, Rogan said he had returned home from a trip on August 28th feeling very weary. I had a headache. I just felt run down. I can relate. Those were my symptoms. 54-year-old recounted, adding, just to be cautious, I separated myself from my family, slept in a different part of the house, and throughout the night I got fever and sweats. I didn't know what was going on. Didn't have the fever. Oh, yeah, I did have a fever. Didn't have the sweats, though. Any more so than normal. Rogan said that his COVID-19 diagnosis, he decided to use all kinds of meds, everything. Monoclonal antibodies, Ivermectin, Z-Pak, prednisone, everything. Okay, so of everything that they could pick out, the mainstream is trying to run with right now, they grabbed one of those things, but not Z-Pak, not prednisone, not monoclonal antibodies, nothing like that. It's just the fucking haunted Ivermectin because it's out there right now. Oh my god. He said, I also got an NAD drip and a vitamin drip, and I did that 3 days in a row. How do you get all that stuff? Well, it's prescribed. You have to go to a doctor to get that. And just because you want something doesn't mean your doctor's going to give it to you. So again, all of this stuff was prescribed to him or recommended to him by a healthcare professional. Gotta make that extremely fucking clear. Rogan said on Wednesday that he felt great and pretty fucking good. That's awesome. Everybody should be celebrating that. He got over the coof, and hey, he lived to tell the tale, like 99.5% of people out there. Rogan has the most streamed podcast on Spotify. That's why they're going after him. And his Instagram account has 13.1 million followers. He'd have more if he'd show more cleavage and wear thong bikinis or whatever that fucking degeneracy cesspool of Instagram is all about. Vaccination status is unclear. I know, right? However, he's been criticized by public health officials for having said that healthy young people need not worry about taking the COVID-19 vaccine. That's not what he said, but he was criticized by the officials. I'm not an anti-vax person, Rogan later clarified on his show in late April. I believe they're safe and encouraging many people to take them. Yeah, you decide yourself, along with your doctor, if you think that the vaccine is correct for you. I'm not telling you one way or another. That is totally your decision. Ivermectin is a generic medicine that can be produced cheaply in many places around the world. Oh, it's for horses, for deworming horses, right? We're going to get into that for a minute. It has been widely used against some parasitic worms and to combat scabies, lice, as well as rosacea. Ivermectin has been considered a repurposed medicine, especially when it was used early treatment of COVID-19 by medical and healthcare professionals. Nobody's ever claimed it's a fucking cure. That would be stupid. Can't believe how lightly I have to tread on this shit. God, it's so fucking stupid. Doctors and healthcare professionals have praised ivermectin for having successfully helped thousands of their patients survive the initial waves of COVID-19. Two groups, the Frontline COVID-19 Critical Care Alliance and the British Ivermectin Recommendation Development Group, I think that they might have a bit of a bias on that one, but again, the old British bird, have been campaigning for the off-label drug or use of the drug to combat the disease amid the pandemic. They want to make it available over the counter. It's still something you need to get a prescription for. However, this approach against the China virus has been met with a resistance from other doctors and federal agencies, including the U.S. Food and Drug Administration, which has said that the drug is not FDA approved for treating and preventing COVID-19 in humans. Yeah, well, neither was a vaccine for the longest time, but you kept telling us to get that, right? And nobody's saying it would prevent it anyways. Nobody's trying to use it to treat it anyways. It's about symptom management, which your beloved Pfizer pills are going to be doing as well. Talk about that in a couple days' time. Taking large doses of the drug is dangerous and can cause serious harm. Imagine that, right? Not following the prescribed dosage recommendations for a drug might be dangerous. Who would have thunk it? According to the FDA, if you have a prescription for ivermectin for an FDA-approved use, get it from a legitimate source and take it exactly as prescribed. Exactly what you should be doing with every other prescription medicine or any other over-the-counter medicine. Holy fuck, people are not this stupid. Some people are. One fucking person. COVID patient hospitalized after overdosing on ivermectin because they're dumb. And other magic cures. Only the media calls them magic cures. Only people with a 75 IQ who can't fucking get it otherwise. An Australian man, oh, he's probably just desperate to just, I don't know, go outside for longer than an hour at a time. Who tested positive for COVID-19 was reportedly hospitalized just to get out of the house after he overdosed on a variety of magic cures. Who's calling him that? New York Post? Is that what you guys are doing? Oh no, this is care of the Associated Press. This is just a reprint. Cool. Including ivermectin, a anti-parasitic drug that has prompted federal health warnings. Oh man, I have many other thoughts on this, but I know that would run afoul of any of that stuff. But again, I'm not saying that this is a cure at all, because nobody is saying it is a cure at all. They're just relaying their own personal experiences, and I thought that was very highly thought of on these big tech platforms. Just saying. A Western Sydney resident who was admitted to Westmead Hospital was lucky he didn't develop severe toxicity after self-medicating. Again, don't do that. That's foolish. It's like that retarded couple who took fucking, something that sounded like another non-prescribed magic cure out there. You know, the fishbowl cleaner. the wife doused the husband with it, and then she ended up taking a lethal dose herself, and then everybody blamed Trump for it, even though they were Democrat voters, and that entire situation is sketchy in and of itself. But again, as this continues, there's no evidence to support the use of ivermectin to treat COVID-19, the associate professor at Westmead said. Oh, that's Noreen Gunja, by the way. Don't look for magic cures online, and don't rely on what's been peddled on the internet, because none of them work. Cool, I'm glad that we can refer to the experts. He's a toxicologist, by the way, not an infectious disease doctor or anything like that, specializing in that. But hey, if he says that there's no studies out there that prove that any of this stuff can be helpful in any way necessary, you should probably believe him, because he has a PhD. It's not necessarily in the field of anybody who could properly research this stuff, but he's an expert. I'm just saying there are some studies out there that, I don't know, he might find a little bit upsetting or troubling or triggering. Ivermectin is a deworming drug often prescribed to animals. Oh, okay, just to them? It's not like it won like a Nobel Prize for distinction with indicated efficacy against something going on in the world right now. No? Oh, okay. It didn't win a Nobel Prize for its multifaceted use in 2015 for treating a bunch of other stuff, like different things that popped up in Africa around a certain time when it came to parasites in the body. Didn't win a Nobel Prize for medicine and that? No? Oh, okay, cool. In 2015, a Nobel Committee for Physiology or Medicine, in its only award for treatments of infectious diseases since 6 decades prior. Hey, wait a minute, none of this stuff exists, I've been told by a toxicologist. Honored the discovery of ivermectin, a multifaceted drug developed against some of the world's most devastating topical diseases. Since March 2020, when ivermectin was first used against a new global scourge, more than 20 randomized clinical trials, oh no, there's no studies though, no, have tracked such inpatient and outpatient treatments. 6 of 7 meta-analysis of ivermectin treatments, RCTs, that would be the random clinical trials, gold standard when it comes to testing and research, reported in 2021 notable reductions in fatalities with the means a 31% relative risk of mortality versus controls. During mass IVM treatments in Peru, excess deaths fell by means of 74% over 50 days in 10 states with the most extensive treatments. Reductions in deaths correlated to the extent of IVM distributions in all 25 states with a science term. Sharp reduction in morbidity using ivermectin were also observed in 2 animal models. Oh, see, it's used exclusively for horses and cows, therefore you can discourage and you can disregard any of the findings in these studies. Again, bro, it's won a Nobel Prize in 2015. It's been researched, and you need to get a doctor in order to prescribe it to you to get it. So I don't know what we're talking here, okay? So yeah, there's a whole host of disinformation, and there's a whole host of reasons as to why people want to actively discourage you seeking the truth, and those are things that we can't really discuss over here at this time. But again, I'm not recommending anybody just go out there and illegally procure drugs that you need a prescription for, because that's illegal, okay? Once again, consult your doctor with what your medical choices should be. Can't believe we need to say that, but hey, that's big tech for you. But I always think that a healthy dose of skepticism has never done anybody wrong. Mostly because these big pharma companies, they don't get held responsible for any of this shit. And another reason why, you remember before the Coof kicked off and pandemic and all that kind of other fun shit out there, before that really started to go wild, what was the big cause du jour? That was the opioid crisis, right? Well, that was a foundation of most painkillers out there, and one of the most widely prescribed painkillers, Oxycontin, ended up getting people hooked. Then the prescriptions would run out, and then people would turn to heroin, and then fucking terrible things would ensue because, hey, opioid addiction is a real fucking thing, and it's a bitch to get off of, because it's one of like 2 things that you can actually die of withdrawal from, so it needs to be approached scientifically and under extreme supervision. Again, something that's a little bit out of my pay grade, but hey, that's what I know. But again, another reason why people are healthily skeptical of big pharma, The Sacklers, who made billions from OxyContin, win immunity from opioid lawsuits. They can no longer be sued for the damage that they have wrought on society. Just like certain other big pharma companies distributing, certain pokes out there. They can't be held liable for anything that happens. Members of the Sackler family, who are at the center of the nation's deadly opioid crisis, have won sweeping immunity from opioid lawsuits linked to their privately owned company, Purdue Pharma, and its OxyContin medication. Federal Judge Robert Drain approved the bankruptcy settlement on Wednesday that grants the Sacklers global peace from any liability for the opioid epidemic. No, it's still a pandemic. Don't worry about it. Why, you guys don't want to diminish that term? Because you want to keep shit going? I get it. This is a bitter result, Drain said. I believe that some level the Sackler parties have liability for those opioid OxyContin claims. I would have expected a higher settlement. Why didn't you do it? You're in charge of it. Complex bankruptcy claim confirmed by Drain at a hearing in White Plains, New York, was negotiated in a series of intense closed-door mediation sessions over the past 2 years. The deal grants releases from liability for harm caused by OxyContin. Oh my God. And other opioids to the Sacklers, hundreds of those associates, as well as a remaining empire of companies and trusts. In return, he agreed to pay roughly $4.3 billion while also forfeiting ownership of Purdue Pharma. But they can't get sued any further. See, man, this is the only reason why I get down on this kind of stuff, because all of these crooked motherfuckers that keep pushing this shit over and over again, they're going to get away with it. And then when there's, hope out there for something, they'll just continue to smash it down under the boot of disinformation or whatever else they want to do in order to keep their fucking fear game going. So yeah, who knows how long this one's going to stay up, but I don't think I made any claims that you could construe as being medical advice because I'm not a doctor. Duh. I didn't recommend anybody do anything. I'm just giving you guys the fact. That's what I try to do every single goddamn day. With that said, I thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.